Hi, my name is Shimla and I'll be talking about dislocated patella. I'll be covering about the anatomy, causes, risk factor, and treatment and complication of the patella. Well, let's start with the anatomy of patella, also known as the kneecap, is located at the front of the knee joint, within the patellofemoral groove of the femur. It attaches superiorly to the quadricep tendons and inferiorly to the patella ligament. It is also classified as a sesamoid type bone due to its position within the quadriceps tendon and is the largest sesamoid bone in the body. The patella has a triangular shape anterior and a posterior surface. The apex of the patella is situated inferiorly, connected to the tibial tuberosity by patella ligament. This forms the superior aspect of the bone and provides the attachment area for quadricep tendon. It has medial facet and lateral facet. Well, to be more specific, medial occulates with the medial condyle of the femur and the lateral occulates with the lateral condyle of the femur. The anterior surface. It is convex and it is connected by the tendon of the quadricep femoris, which is continuous below with the superficial fibers of the ligament patella. It is separated by the integument by a bursa. Next, the posterior surface. It has a smooth oval articular area, which is divided into two facets by a vertical ridge. The ridge corresponds to the groove on the patella surface of the femur. And the attachment to the ligament patella, the upper half is separated from the head to the tibia by the adipose tissue. Functions. The patella has two main functions. Well, first, leg extension. Enhance the leverage that the quadricep tendons can exert on the femur, increasing the efficiency of the muscle. Protection. Protects the anterior aspect of the knee joint from physical trauma. Causes. Most dislocation occurs laterally and are caused by high force impact on the patella or forceful sudden twisting of the knee. This mechanism of injury makes patella dislocation more common in individuals participating in sports. Ouch! Here are a few examples of sports. Patella fracture is a direct trauma to the bone or sudden contraction of the quadricep muscle. They are more common in males and in the 20 to 50 age range. If the patella fractures into fragments, they will separate. The proximal fragment displays superiorly by the quadricep tendons and the distal fragment pulled inferiorly by the patella ligament. Here are the symptoms. You may hear a crack, the kneecap may feel out of joint surroundings, the tissue will swell up, extremely painful, you won't be able to walk, knees appears to be deformed, knees bend and cannot be straightened, kneecap dislocates to the outside of the knee, sloping kneecap. Complications. Tearing of muscles, nerve or blood vessels, susceptibility of the re-injury if you have a severe dislocation or repeated dislocation. Affects joint as your age. Ligaments or tendons that support your injured joint have been stretched or torn, or if nerves or blood vessels surrounding the joint have been damaged, you may need a surgery to repair these tissues. Movement of the knee. We have flexion and extension. Flexion, the bending of joint resulting in a decrease of angle, moving the lower leg towards the back of the thigh. Extension, strengthening the joint resulting in an increasing of angle, moving the lower leg away from the back of the thigh. For example, the test and diagnose have X-ray and MRI. Treatment. Rest your dislocated joint, apply ice and heat. Take pain reliever, maintain the range of motion joint. How to prevent a dislocation. Take precautions to avoid falls, stay safely, lastly avoid reoccurrence. Thank you.